Bharatiya Parampara that the Hari is a Sthitikaraka, where he is with everything, and whatever is happening, it's because of his thoughts, and the actions is because of which it is happening. So we treat the doctors as Hari. That means the highest and most conscious, or on every second they should keep their conscious on the needle tip. So this is what today's doctors and the future doctors will be definitely are, and the journey will be like the service and service all the time. So out of passion, yes, many are dreaming out like I should be a doctor, there should be a tagline of doctor in front of my name. Yes, that is cool, but Dr. Tejaswini Ramesh has clearly stated that everything is there, but what is that chiseling, what are the footprints you need to cover up, and how you need to take your journey. It was indeed a very interesting and most heartwarming words by a humble heart or a healing heart. I can say thank you, Dr. Tejaswini Ramesh, for being a part of Pragnya, and we hope all your journey will be a blessed one, and may all the patients who seeks you will be healed with godly strength, which will be imparted for your further journey. And for as usual, as we end the talk, we do have few questions. As audience point of view, I do have few questions for Dr. Tejaswini Ramesh. What if AI is dominating the field, and there is a lot of recession which we are facing, and there is a lot of jobs which is going to take away the job industry, and there is a lot of disturbance which is causing the demand and supply chain definitely is going to change. How this AI will affect? Is it a boon or a bane to the medical field? And is it going to change anything in a very big way, or is it benefit for the patients and as a doctor journey? And how will it benefit the society as a whole? In your perspective as a doctor, how you'll see this growth or a change? That is first question. And second question is why anybody needs to pursue medicine strongly. So these are few questions which I am asking as a part of an audience questions. So I hope you will give justice to these two answers, and after that we'll just wind up this session. Over to you, madam.
Thank you, sir, for those questions. Actually, the first question, when it comes to AI replacing the medicine field, that is quite impossible, because nobody's going to go through so much for an AI app to come and replace you. Nobody can come and deliver a baby. Nobody can cut through. I know robotic surgeries have far come ahead, but a human touch and a human heal is far more different than an app talking to you and treating you. And coming to a practical aspect of AI, the field that can actually be very much affected by it would be radiology, because that is but it cannot predict everything, because it is always a radiologist work that tells you behind something. A clinician who cannot see it, that's a radiologist work who's going to give us the insight of things that we cannot see, and that work could be little bit there'll be little bit difficulty, where an AI could practically replace them. They cannot replace them, but they are the person who's going to take the hit of an AI. But surgical field, it's quite impossible, because AI cannot replace surgical field, because you need a physical doctor to do that. But robotic surgeries have come up, which is a good thing, but you require a surgeon to go through a robotic surgery. Robotic surgeries are different compared to an AI. AI is where you just put up a photo and ask about the reports and everything, and the AI answers for you. And as I told you, that is, the radiology is a department, or dermatology, where you kind of answer your own questions. That could be a department where you kind of take the hit, but not the surgical field. So people who are worried about getting replaced by AI and have an interest towards surgical field, go towards surgical field, and nobody can touch you with your AI. I think when it beat radiology also, it's just the myth that people keep talking about AI replacing medicine and everything. To clear that up first. And secondly, if you the second question of really, if you really want to, what is meant, why do you have to be in this field of medicine? It's all about pure intention, what your intentions are. If your intentions is money, please forget it. This is not the field, because you will make much more money earlier than it. My colleagues who are there when I studied in PUC and all, they're making much more money compared to what I'm making now. It is not about the money. It's about the fact that if you really want to make money and come in this field, you will never get through, because you talking to the patient, you treating the patient, and how you go through the patient is quite different when you want for money and you want to heal them for what the pain they've come for. So if you are coming with an intention of, I want to heal that person, I want to take away their pain because I understand what pain they're going through, that will put you in a place where nobody can touch you. Your money will just fall to your foot. It's not about that. It's about your, I personally choose this because when there's a lot of pain and somebody is curing that pain, that person is nothing but equivalent to a god to me, right? So that when I cannot see God, but that person is taking away my pain, he's everything for me. The kind of respect that you earn from that person that you've never seen in your whole life just comes and prays you, and tells that thank you so much, you took away the pain that I had, and you are no less than a god for me. That for me is, that's all you need for the rest of it. The whole day I wouldn't have, my personal experience I'm telling, the whole day I would have not eaten, I would be exhausted, I just keep cursing myself, why did I come to this field? But the next day morning I just go to a patient and they just tell that the way you treated us, I'm just so immensely happy, and they start crying sometimes. They give you food because you wouldn't have eaten food, and that time you realize, okay, this is what I came for and this is what I'm meant to do. It just get that feeling just comes inside that, okay, this is what I'm meant to do in life. So if you're joining this field, you're most welcome. This field is going to be so fruitful and it will be filled with happiness, but it is equally going to be very, very, very difficult, where you sometimes lose yourself, where people are going to talk, thinking you're not there, because you'll really not be there for most of your family functions and family time. That's really how your life is going to be. But you can, if you really have that passion of I am going to heal people and do good to people with these two hands that God has given you, you will be in a very good place, and you really have to come to this place. We'll be waiting on this side. Yeah, thank you.
Thank you, madam. It was indeed a very straightforward answer from Dr. Tejaswini Ramesh. I wish these are the two main questions from an audience point of view. And thank you for your time, madam. And I wish all the best for all the upcoming doctors who is taking the medicine field. And definitely, to the end note, there is a Sanskrit shloka. It says, Sarve bhavantu sukhinah, sarve santu niramayaha, sarve bhadrani pashyantu, ma karshit dukkhavat gavet. Om Shanti Shanti Shanti. Thank you.